Hello, I am Dr. Atmaranjan Dash. I am a neurosurgeon, senior consultant neurosurgeon at Care Hospital, Bhubaneswar. I here today will discuss about sciatica problem and lumbar canal stenosis, which is and spine problems in elderly population. So first we have to understand how a spine is made. A spine is made by bones, which is known as vertebral bodies, which has cervical, which has upper thoracic vertebral bodies, and the lumbar spines or lumbar vertebral bodies, through which a thick spinal cord passes through. From the spinal cord proper, we have multiple ramifications of nerves which supplies your hand, leg and the body trunk. So now today we'll discuss about the lumbar spine problem or lower backache, which is a very common and very prevalent problem in the population. It starts from the age of 20, and it is very common that the first episode or first attack of lower back pain starts around 20 to 40 years of age, and then subsequently repeated attacks also happen with some people. So the major cause of the back pain is mechanical back pain, which is because we know our back is a machine, our body is a machine, so it has mechanical problems like which we call sprain in the back. This is because of prolonged lifting of heavy weights, or sitting for a prolonged period in the floor, not maintaining proper posture while driving, gymming and sports activities, which may lead to mechanical back pain. Then we'll move to the second most common cause of back pain, which is known as discogenic back pain, which, because we know between the vertebral bodies or the bones of the spine, we have a very soft material which gives a cushion effect to the bones, which is known as a disc because it's round in structure. It has a outer structure which is little tough, and the inner structure which is like a jelly. So because of repeated flexion or bending forward or abnormal posture, sometimes because of compression by the two bones, the jelly type material comes out, compresses your nerve, which is also known as sciatica, because most of the time the nerve which is compressed by this discogenic back pain is a sciatic nerve, which is formed by a multiple number of nerves in the lumbar spine. So because of sciatica, the patient will experience excruciating pain in the back of the back side of the leg, which will start from the back and go towards the foot. So this is a very common problem. So ideally it happens with only with one limb, and sometimes can involve the other limb. Then we'll go to the back pain in elderly population, which is known as lumbar canal stenosis, which is because of a degenerative process and because of the aging process. The canal through which the spinal cord passes gets compressed, because of which the nerve blood circulation at that level is compromised. Whenever you start walking, whenever there is blood flow to the leg, the patient will start neurogenic claudication, which is the patient typically will explain once he starts walking. After some distance, he will feel severe pain in the lower limb, and there will be some cases there will be weakness in the limbs. So the person has to sit for some time so that the pain gets relieved, and then it starts walking again. So typically this is seen in groups who do a lot of morning walk in the morning, where some elderly patient they will say ki my group is walking fast, me and I was not able to walk further, I have to sit, take some rest, then I join the group, which is very typical with lumbar claudication. So this is very common in the elderly population. Then we'll move to other aspects of problem, which is known as a pars fractures in the spine. It can be osteoporotic fractures or can be pars interarticularis fracture. So osteoporotic fractures also happens in the elderly population, but now because of abnormal diet intake and lack of balanced diet concept in younger population, also this kind of fractures are happening nowadays. And pars interarticularis fracture is one of the missed diagnosis and is a cause of failed back syndrome after in some cases where the fracture happens at the joint level of the spine, and the patient will experience pain in the morning. There will be morning stiffness whenever they get up in the morning. The back will be really stiff, but when they start walking, the pain is relieved sometimes, but whenever they change position, the pain gets aggravated. The other causes of back pain can be a spine tumor, which is known as schwannomas or benign tumors of the back, and it can maybe because of the infection caused by tuberculosis. You know, tuberculosis is very prevalent in India. Most of the because of overcrowding and because of high population, the TB is very prevalent in India, and sometimes if your pain starts in the back and does not get relieved as the time passes on, it keeps on increasing, then tuberculosis is also a possibility. In those cases, you may have evening rise of temperature and sometimes weight loss. So if you're having weight loss, evening rise of temperature and back pain, we can think of bone tuberculosis or spine tuberculosis. So then we know we have to think how we can prevent this kind of back pain. We have to take proper diet and do the back strengthening exercises, yoga to increase the flexibility of the back, maintain your posture so that you don't get that much of stress on your back, because you know the whole of the body's weight is focused at your lower back. So maintain good posture, take good diet, do regular exercises, move your spine, maintain the flexibilities of spine and prevent the problems of back pain. So now we'll discuss when to visit a doctor. That's a big thing, when to visit a doctor and when you should ask for a consultation with an expert. So this is when your pain does not stop coming down after medications and after physiotherapy. Then you should consult a expert in spine and get yourself evaluated, which the typical term is known as chronic back pain, where your pain does not come down even after a lot of medications for a month, 2 months, 3 months, 4 months. The time passes on, but the pain does not come down. In those cases, you have to take a consultation of a doctor and do yourself evaluation. In if you come to a doctor, they first do a evaluation clinically, then do x-rays, and then finally we do a MRI, which is known as where we see the nerves, condition of the nerves, or probably if you have some infection, that also be picked by the MRI. To discuss about the treatment plans for back pain, also chronic back pain, acute back pain. So there first we try with conservative management. If you are having severe back pain, we give you over the counter drugs and do as we promote physiotherapy in the beginning phases of time. When you are not having an acute back pain, we promote physiotherapy, do back strengthening exercises, physio and all. 90% of cases the pain gets relieved with physio and the medications. We avoid giving painkillers. Normally we give the patient nerve soothers, which makes your numb your nerves a little so that the pain is relieved. And if 10% of the cases where the pain does not get relieved, we do not directly go for them. We do not directly go for a surgical intervention immediately. We try. There are other options between surgery and medicine, which is known as intradiscal cocktail injections. You can give epidural steroid injections. Also, we have radio frequency ablation of the joint and ozone therapy of the disc, also known as ozone nucleolysis, where we shrink the disc, and these are done for younger patients who have a disc bulge, but there is a protrusion of disc bulge, but the disc is completely confined between the annulus. So in those cases, we give ozone inside the disc, where the disc itself shrinks, so the pain gets relieved. But if it fails in some cases, then we go for surgical procedure, and we know we have a very recent surgical innovation, which is known as biportal endoscopy, also known as laparoscopy of spine or banded spine surgery, where with a laser probe we have very small holes, which is almost around 5 mm in size, and we make just 2 holes, small holes, and through which we can take out, widen your canal if you have a stenosis. If you have a disc, we can remove it, and if some cases if you have a fracture of pars interarticularis or listhesis, we can do it. It is very safe, very new, because we know one of the recent, you should always take the advantage of recent innovation in surgical field, and see the results are you operate on the same day and go back to your house on the same day. So these are basically designed for pilots who fly a long haul flight, and they have, because of prolonged sitting, they have a back pain, so they operate on the weekend and they join back on the duty on the first Monday. So these are very nice innovations. You can take the help of this if you are suffering from chronic back pain, and if you come within that 10% group which actually needs intervention for the back pain. Thank you.